Welcome back to Oral Health and Medicine Separate Not Equal. In today's vlog, we'll be delving into the connections between drug use and oral health. Drug abuse is one of the world's most destructive and devastating health problems, and oral health complications are among the most prevalent health problems associated with substance abuse and addiction. Many people tend to associate drug abuse with damage to the lungs, heart, and brain, even though many drugs may actually cause more damage to the teeth and gums. Most drugs cause dry mouth, which means that less saliva is produced. Since you need saliva to clean your teeth, many people who use drugs suffer from poor oral health. Additionally, many drugs that are stimulants such as meth, cocaine, and ecstasy can cause clenching and grinding of teeth, which can ultimately weaken your teeth. And what makes this situation worse? Those who need the most help are often the ones who neglect oral hygiene and do not visit a dentist. Sometimes those who use drugs also smoke, which can make the effects of drug use on one's mouth even more severe. Some of you may be aware that meth abuse damages teeth, but have you ever thought about how this occurs, as well as some of the other drugs that have the potential to cause damage to your mouth? Methamphetamine is an acidic drug that wears away enamel at a very fast pace, and many people who struggle with meth addiction tend to crave sugary foods and drinks, which can damage oral hygiene and amp up damage from acid production. One study conducted by students at the University of California, Los Angeles found that 96% of people who struggled with meth abuse had cavities, 58% had untreated tooth decay, and 31% had 6 or more missing teeth. Marijuana users similarly suffer from dry mouth and in some cases may go on to develop cannabinoid hyperemesis syndrome, which can lead to nausea and vomiting and contribute to enamel degradation and tooth decay. Opiates such as heroin cause similar oral complications to methamphetamine, like discoloration, broken or missing teeth, and gum disease. In fact, injecting these types of drugs can put people at higher risk for various infections, which can cause oral fungus or viral infections that affect the mouth. Since opioids also reduce pain, there could be a loss of sensitivity that could contribute to a person ignoring pain from gum disease or cavities. Not only can these drugs cause direct damage to oral health, but long-term drug use can be accompanied with secondary issues that can further impact mouth, teeth, and gums. Moving forward, dentists should screen their patients for substance use, be on the lookout for periodontal disease that's inconsistent with the patient's age, and think about referring to medical doctors for management. Doctors and clinicians also play a really important role. They should similarly screen for oral diseases and arrange for dental care as needed. It's critical that they warn patients about the oral health risks connected to dry mouth and cravings for sweet food, and possibly in implementing programs to improve access to dental care among drug users and incorporating addiction literature into these programs could be a beneficial first step.